Hello everybody, this is Dr. Ken Muich from the Fibromyalgia Wellness Center, and this is a very, very interesting subject again that we'll be discussing. I'm going to be explaining to you a number of things that maybe you never even realized, and it has to do with fibromyalgia fatigue and that famous phrase Fibro-Fog for fibromyalgia patients. We have to go back, first of all, and understand a little bit more about where this all comes from. Dr. Saint Aman, who I work with out of UCLA Research Center, actually in his research found that there were genetic markers on fibromyalgia patients, which means that you were born, believe it or not, with fibromyalgia. Now, I've spoken so many different times to patients when they first come in, and the history is that, well, I was tired and achy and so forth, but when my parents would take me to the doctor, they kept on saying that it was growing pains, and so because they couldn't find anything wrong, which is very, very common with fibromyalgia patients. The objective testing, as I've mentioned before, the X-rays and MRIs and blood tests and so forth all come back negative, and so that's a real problem of a misdiagnosis, so to speak. So what happens is that when a patient starts, actually a fibromyalgia patient actually has some form of trigger, some physical, emotional, or chemical trauma or multiples thereof, an auto accident, a severe illness, death in the family, molds and spores. This is what really triggers the fibromyalgia into what we would call an acute stage. Now, this is not a new condition, fibromyalgia. You can go back, as I've mentioned before, if you've heard any of my talks, this goes back to biblical times. And so this has evolved over a number of, not just decades, hundreds of years, into the understanding a little bit more of fibromyalgia. Now, this UCLA research that Dr. Saint Aman found actually found that there was excess amounts of phosphate and calcium in the cells. What does that mean to a fibromyalgia patient? Well, the excess phosphate in a cell actually burns out the batteries of your energy body, so to speak, the mitochondria. There's trillions and trillions of these in each throughout your body and in each cell in your body. What that does is it does not allow the body to produce adenosine triphosphate, ATP, which is really the energy source that you go through, whether it be my talking, my blinking, my movement, so forth, my skin, my organs. Everything evolves around this mitochondria and production of adenosine triphosphate. The other excess amount in cells is calcium. You might think, again, as I mentioned to you a number of times, that calcium is something that would be great if if it were actually processed into the bones. However, if it stays in the cells, many people don't realize that calcium is a muscle stimulant. And if it stays in the cells, that means your muscles are constantly at a state of activity. What is important about that is that you heal under deep REM sleep, but fibromyalgia patients can be in bed 8, 10, 12 hours and they get up and they felt like they've never even slept. And again, the reason why is you never receive that deep REM sleep processing in your body, and that actually adversely affects your body's ability to heal. All those injuries and accidents and strains and sprains and illnesses and so forth actually evolve and heal during that restful deep REM sleep. But if you don't have that, then obviously you have a problem. So the fatigue factor evolves into something called the fibromyalgia fatigue that you have that affects your entire body. You have a difficult time processing even simple thinking processes, so to speak. And that's where we get into the Fibro-Fog. Now, the Fibro-Fog is very, very interesting. It's a phenomenon, phenomenon in that it affects your thinking, your body's ability to process different things, concentration, just being able to add figures, so to speak. Now, this is from an inflammatory disease. Rheumatoid arthritis is an inflammatory disease, but fibromyalgia is not an RA condition, because rheumatological conditions really, for the most part, except for one condition, is bone destructive. Well, fibromyalgia is not bone destructive. You can have rheumatoid arthritis or osteoarthritis with a number of other different conditions. As I mentioned, fibromyalgia patients just don't have fibromyalgia. They have other conditions that fibromyalgia makes worse. But fibromyalgia in itself was put under the auspices of rheumatoid arthritis or rheumatological conditions because I just got the feeling they didn't know where else to put it. And so they just kind of stuck it with rheumatoid arthritis conditions or rheumatological conditions. Research has shown that rheumatological conditions actually cause patients to have a problem as far as mental capabilities, cognitive symptoms, such as difficulties thinking and processing different information, memory, all sorts of different concentration type things. I know when fibromyalgia patients come in, I don't make fun of them, but it's almost like the duh syndrome. I'll ask them a question and they'll think about it for a little while before they actually answer it many times because of this Fibro-Fog, which is really part of fatigue. I find it somewhat difficult to differentiate the two. If you're fatigued, you have a difficult time concentrating, I think, and I think most people would be able to find that to be true. So there's cognitive problems that patients have. For rheumatological conditions, they find about 30% of rheumatological conditions actually cause these cognitive problems. When it comes to fibromyalgia, research has shown that it's at least 60%. Well, in my clinic, I would say that almost everybody, I'll hate to say all, every, and never as far as fibromyalgia or any condition is concerned, but almost every fibromyalgia patient that comes in has both fatigue and I believe Fibro-Fog, just based upon a number of questions that I ask them, because when they come in, we usually spend 45 minutes to an hour just going over their history and a variety of other things and so forth before we even go into any of the other aspects as far as treatment, if we can help them. So that is in itself the Fibro-Fog aspect. But what if I were to tell you, though, that that Fibro-Fog, the inflammatory reaction causing cognitive symptoms, actually causes a loss of gray matter in your brain, believe it or not. For those people that have had long-standing inflammatory responses for periods of time, and I know fibromyalgia patients have been in pain for a number of years, decades as a matter of fact, this actually research has shown to actually have an adverse effect on the gray matter of your brain. Why is that important? Well, that is for concentration, thinking. It also can cause depression, anxiety, and additional fatigue. And how much? Well, actually, over, I think, maybe a 10-year period, you can lose 5 to 10% of the gray matter. And so that is extremely important, so that when fibromyalgia patients do come in, we start to treat them as quickly as we can to make sure that we get the inflammation down off their body, so that actually helps them physically, emotionally, reduces depression, so forth and so on. So I think that's extremely important to get a start on fibromyalgia patients. Another thing is, because of this cognitive response, they have found that the patients suffering from these problems oftentimes is worse than the pain they're suffering in itself. So research specialists have said, okay, so what can we do to minimize some of these problems? Well, one thing they suggest is at least 150 minutes a week of exercise. Well, I don't know about you, and if you've ever dealt with fibromyalgia patients, or if you are a fibromyalgia patient, exercise to most fibromyalgia patients might just be getting out of bed, or barely walking to the mailbox, or putting your clothes on. But what I do find is that it is important for your overall body health that you do as much as you can below the level of increasing your pain to move. Motion. If you don't move it, you lose it, so to speak, and that's so extremely important for fibromyalgia patients. Another thing that they suggest, and I suggest this to all my patients, because who is not working on a computer, for crying out loud, is crazy. You're not made to sit hours at a computer or at any desk. So they suggest that, and I suggest the same thing. If you want to help yourself, get an egg timer and set it at 30 minutes. And at 30 minutes, when it dings, get up and at least walk around your chair Stand up, stretch a little bit. Don't be sitting for longer than 30 minutes. I have a tendency to have a problem with that. I get so involved in going through emails, answering people's questions and so forth that I have to be reminded by my lovely bride, get up and walk around and get off the computer. And that is a real problem that a lot of people have. And other things that they mention is that corticosteroids, and that an example is prednisone. Steroids can have an adverse mental effect on individuals as far as being able to remember, concentration. They call it, I'm trying to remember, let's see, fuzzy thinking. Fuzzy thinking, that's what they call it. And so if you're on long-term prednisone, I suggest you ask your doctor if there's something else that you might want to use or some other non-corticosteroid to assist you, or at least go off it for a short period of time, maybe to help get back your senses. The problem is that once you get corticosteroids in your system, they have a very long half-life, which means they stay in your body for a longer period of time. And so you really want to make sure that you take care of that and see if there's an optional form or way in which you can be treated. So check with the medication and drugs, and if their side effects have to do with that, sleepiness, a concentration off, so forth and so on, keep looking or ask your doctor to find something to assist you. Keep in mind that the longer that you have the pain, it does adversely affect, again, the gray matter, which is your ability to remember and think and concentrate and so forth. But still, it does have secondary side effects if you're taking medications that will magnify that. And then there's the other thing is a lot of fibromyalgia patients, they find that have cardiovascular problems, heart, etc., that you should try to get onto probiotics. That will also help as far as to neutralize a lot of the things that you may have in your system, and also the mental, again, concentration factors. So probiotics would be a positive for you to take. Listen, I'm not adverse to medications. I'm not adverse to things like probiotics or anything that might help in a short-term basis for individuals, as long as they do not have adverse effects for the individual. But when they do, obviously that just multiplies the problem as far as the patient is concerned. So, fibromyalgia, fatigue from excess phosphate and calcium in your cells. Again, the phosphate burns out your batteries that allow you to do things, and so that's a fatigue factor. And then add on to that the excess calcium in your cells, which constantly causes your muscles to be at a state of activity. As crazy as that sounds, it does. It actually does not allow your body to be at rest. And so that's another fatigue factor. As far as the Fibro-Fog is concerned, again, research has shown that, number one, if you have pain for a long period of time, that will adversely affect the gray matter of your brain. Also, because of inflammation, long-term inflammation and pain causes anxiety, fatigue, depression, things of this sort. Again, that will adversely affect your body's ability, your mind's ability to concentrate and do things properly. And so get up and try to do everything you can as far as action or activity. Try not to be sedate, just sitting. Again, try to get up every 30 minutes, at least stretch and walk around a little bit. I know for some of you that's going to be extremely difficult. I know there was a study in, I believe, Canada from physical therapists that they said exercise will take care of fibromyalgia. Well, that would be nice if you could exercise, but like I say, most fibromyalgia patients that I have had come in can barely get up and go to the mailbox, no less go and do some long walks and so forth. You know how much you can do based upon your symptoms. The fibromyalgia patients, some can't do it. Some still stay active, they're working, so forth and so on, trying to get through best they can. And continue that, but try to add some minutes onto your exercise capacity during at least a week, and I think you'll maybe hopefully find that at least you'll be able to think a little bit better and maybe reduce the fatigue aspect. As far as the pain is concerned, again, that has to do with some other aspects with fibromyalgia that are causing that, and that's what we're going to be talking about next time, and that is salicylates and fibromyalgia and how it adversely affects you, especially on our protocol. On April 21st, 22nd, We're having our seminar for health providers, health professionals, to explain to them the fibromyalgia protocol so that they'll be able to take it out and see a lot more patients and help them, help you wherever you may be, whatever state you may be in. So we're going to be doing some weekend traveling to train doctors so that they'll be able to help you, because I cannot reach out my arms to Oregon or Florida or New Jersey and help patients that are calling in for assistance, because you need a trained professional, health professional in our protocol to assist you. And that's extremely important. You can't map yourself. You can't actually really find the exact amount of guaifenesin that you need to take unless you are mapped properly and you find out exactly what you need to take. And also the 18 points and a variety of other things, whether or not you're ingesting or putting salicylates on your body and so forth, that might be adverse to you also. I have a question coming in. I'm just going to double check here. I was on very high doses of prednisone in Washington. Okay, now fibromyalgia. Well, prednisone I don't think causes, as I mentioned to you, prednisone does not cause fibromyalgia. But as mentioned just a few moments ago, that prednisone, long periods of prednisone can have that increase in Fibro-Fog that you're going through, and it does stay in your body for long periods of time before it actually washes out. So again, try to get to your doctor and ask them if there is something other than a corticosteroid, something that does not have that adverse side effect, so that, or maybe you can go off of prednisone. I have some patients that go on prednisone for a short period of time, and then they go off of it because it has such a good response to certain conditions. So maybe you don't need to be on it all the time. Prednisone also has an adverse effect of increasing a lot of water weight in patients. I've seen them really literally blow up if they've taken it too long or too high of a dose. So Melissa, I hope that answers your question, because you already have, as I mentioned to you, you already have fibromyalgia. You were born with it, maybe at a lower level. But whatever conditions and so forth, secondary conditions that may have triggered the fibromyalgia at a much higher rate of symptomatology, so to speak, higher levels of symptoms and more painful. So again, I can't say stop taking prednisone, but what I can do is suggest that, because I don't know what your condition might be, but I can suggest that you talk to your doctor and see if there's an alternative medication that doesn't have the same side effect that you have to deal with. Any other questions out there while I have you? Otherwise, I want to thank you so very, very much. Again, next week, next Monday, we'll be talking about the salicylates and fibromyalgia with our protocol, and some other aspects I think that I might be adding that might assist all of our lovely individuals out there that and sufferers of fibromyalgia. I want to thank each and every one of you again. Let's see, I have not now hurt my body so much. Yes, I was born with it. Thank you. Yep. Okay. That is, as I just mentioned to you, that is a problem with strokes, cardiovascular problems. A lot of fibromyalgia patients do have those, and so again, you might want to try probiotics, and that may assist you. Hopefully, like I say, you are not on too many other medications, and if you have a chance, take a look at my book, Fibromyalgia: Falsehoods, Fakers, and Facts. It gives our protocol in there, and also my website, fibrowellnesscenter.com, because I regularly blog and I have a lot of information on a number of subjects that patients request and ask. Again, I want to thank each and every one of you for allowing me to visit with you. I look forward to seeing you next week, again Monday at 12:30, and I'll be putting out information as far as what we'll be discussing. Thank you again. Have a wonderful week, and blessings to all, okay? Bye-bye now.